Introduction. In this lecture, we will explore in depth the anatomical region known as the axilla, or axillary fossa. This region is of great importance in human anatomy, not only because of its structural complexity, but also due to its clinical relevance. The axilla can be defined as a pyramidal-shaped anatomical space, more precisely described as a truncated pyramid, located between the lateral wall of the thorax and the upper limb. It serves as a transitional passageway, connecting the structures of the neck with those of the upper extremity. Because of this strategic location, the axilla contains essential neurovascular elements that supply the upper limb, making it a key region for both anatomical study and clinical practice. General anatomical overview. The axilla is not simply an empty space, rather, it is a highly organized region filled with connective tissue, fat, vessels, nerves, and lymphatic structures. Its pyramidal shape allows for efficient distribution and protection of these elements. The concept of a truncated pyramid means that the axilla has an apex at the top, a base at the bottom, and 4 distinct walls. Each of these components contributes to the structural integrity and functional organization of the region. Understanding the spatial arrangement of these boundaries is essential for visualizing how structures pass from the neck into the upper limb. Apex of the axilla, CERVICOAXILLARY canal. The apex of the axilla, also known as the cervicoaxillary canal, represents the superior opening of this pyramidal space. It forms the communication between the neck and the axilla. Anatomically, it is bounded anteriorly by the clavicle, posteriorly by the superior border of the scapula, and medially by the first rib. This canal is extremely important because it allows the passage of major neurovascular structures, including the subclavian vessels and the roots of the brachial plexus, which enter the axilla and continue toward the upper limb. Any compression or injury at this level can significantly affect the function of the entire upper extremity. Base of the axilla. The base of the axilla forms its inferior boundary and is directed toward the skin. It is composed of 3 main layers: the skin, the superficial fascia, and the axillary fascia. Together, these layers create the floor of the axilla. The base is not rigid. Instead, it is flexible and mobile, allowing the arm to move freely while maintaining protection of the deeper structures. This flexibility is essential for normal shoulder and upper limb movement, especially during abduction and elevation. Anterior wall. The anterior wall of the axilla is primarily muscular and is formed by the pectoralis major and pectoralis minor muscles. The pectoralis major is a large, superficial muscle responsible for movements such as adduction and medial rotation of the arm. Beneath it lies the pectoralis minor, a smaller muscle that plays a role in stabilizing the scapula. These muscles also serve as important anatomical landmarks, particularly the pectoralis minor, which divides the axillary artery into 3 parts. Additionally, the anterior wall contributes to the formation of the anterior axillary fold, which is visible externally. Posterior wall. The posterior wall of the axilla is also muscular and is formed by the subscapularis, latissimus dorsi, and teres major muscles. The subscapularis lies on the anterior surface of the scapula and is part of the rotator cuff, contributing to medial rotation of the arm. The latissimus dorsi is a large, powerful muscle involved in extension, adduction, and medial rotation of the humerus. The teres major works together with the latissimus dorsi to assist in these movements. Together, these muscles form the posterior axillary fold and provide structural support to the back of the axilla. Medial wall. The medial wall of the axilla is formed by the thoracic wall, specifically the upper ribs, and the serratus anterior muscle. The serratus anterior is a key muscle that anchors the scapula to the thoracic cage and allows smooth movement of the scapula during arm motion. This wall is relatively thin compared to the others but plays a crucial role in separating the axillary contents from the thoracic cavity. Damage to the serratus anterior, particularly injury to its nerve supply, can lead to a condition known as winged scapula. Lateral wall. The lateral wall of the axilla is the narrowest of all the walls. It is formed mainly by the intertubercular groove of the humerus. Despite its small size, this wall is significant because it marks the transition between the axilla and the arm. It also provides a pathway for structures entering or leaving the axilla toward the upper limb. Contents of the axilla. General organization. The axilla contains a large amount of loose connective tissue and fat. This adipose tissue acts as a cushion, protecting delicate structures such as nerves and blood vessels. At the same time, it allows these structures to move freely during arm movements without being compressed or damaged. Within this space, we find several key anatomical components: the axillary artery, the axillary vein, the brachial plexus, and the axillary lymph nodes. Axillary artery. The axillary artery is one of the most important structures within the axilla. It is a direct continuation of the subclavian artery and begins at the lateral border of the first rib. It continues through the axilla and becomes the brachial artery at the lower border of the teres major muscle. A key feature of the axillary artery is that it is divided into 3 parts by the pectoralis minor muscle. Each part gives rise to specific branches that supply the thoracic wall, shoulder region, and upper limb. This anatomical division is crucial for both learning and clinical procedures, such as surgeries or catheterization. Axillary vein. The axillary vein runs alongside the axillary artery and is responsible for draining blood from the upper limb. It is formed by the union of the brachial veins and the basilic vein and eventually becomes the subclavian vein. The axillary vein is an important structure in clinical practice because it is often used for venous access in medical procedures. Due to its large size and accessibility, it is commonly used for central venous catheter placement. Brachial plexus. One of the most complex and clinically significant components of the axilla is the brachial plexus. This is a network of nerves formed by the anterior rami of spinal nerves C5 through T1. The brachial plexus is organized into roots, trunks, divisions, cords, and branches. Within the axilla, the cords of the brachial plexus are named according to their relationship with the axillary artery, lateral, medial, and posterior cords. These nerves are responsible for both motor and sensory innervation of the upper limb. Any injury to the brachial plexus can result in severe functional impairment, including loss of movement or sensation. Axillary lymph nodes. The axillary lymph nodes are another essential component of this region. They are responsible for draining lymph from the upper limb, the thoracic wall, and particularly the breast. These lymph nodes are organized into groups, including pectoral, subscapular, humeral, central, and apical nodes. Their clinical importance is especially evident in cases of breast cancer, where cancer cells may spread through lymphatic pathways. The evaluation of axillary lymph nodes is therefore a critical step in cancer diagnosis and staging. Clinical importance. The axilla is a region of great clinical significance. Injuries to the brachial plexus can occur due to trauma, leading to conditions such as paralysis or weakness of the upper limb. Compression of the axillary vessels can result in vascular syndromes, affecting blood flow to the arm. Additionally, the axilla plays a central role in the spread of infections and malignancies, particularly breast cancer. Because of this, surgeons and clinicians must have a precise understanding of axillary anatomy when performing procedures such as lymph node dissection or vascular access. CONCLUSION. In conclusion, the axilla is a complex and highly organized anatomical region that serves as a vital connection between the neck and the upper limb. Its pyramidal structure, well-defined boundaries, and rich contents make it an essential area of study in anatomy and medicine. A thorough understanding of the axilla is not only important for academic purposes but also for clinical practice, where accurate knowledge can directly impact patient outcomes. Thank you for your attention.